Hey guys, welcome back to It to Be Pretty podcast. I'm Angel Martinez.
And I'm Lexi Wilk. And you are?
Sam.
Our special guest, our nurse injector, our lead nurse injector, Sam Finley. Thanks for being with us. She's not a guest. I feel like she's family coming in and we're chatting all things lips. By the way, it is the month of love. How do you feel about the month of love?
How do I feel about it? No, I feel good about it. I love love. I think everyone deserves love, whether it's loving yourself, whether it's loving your partner, whether it's loving your lips.
Yes. What about you, Sam?
Love.
Do you love the month of love?
So I
some people,
actually
like,
hated it for a while.
Hate it.
I hated it for a while, but
Why?
I just thought it was so contrived and forced, and that guys should buy their partners or anybody should buy their partners flowers and gifts, and not just forced because of media.
Do you think it's a girl holiday? Brennan, do you
rebrand?
I mean, maybe a note would be nice, but
you would want just a note? Here you go. Come on.
He doesn't want anything.
He wants something. Guys want things. I don't think.
Yeah.
Yeah.
What do you, I usually get my man for Valentine's Day, I'll get him a jacket or a pair of
A BJ?
No. Well, it depends on the year.
Absolutely not.
It depends on the year.
If he's lucky.
Not the day. It depends on the year.
Every year he asks for anal and he doesn't get it. I said, he knows this too. I said, anal will happen the day you propose, and that is my final answer. It's been this answer since the day we started dating.
Whoa, ultimatum.
I know the ultimatum.
Jeez. Just
damn.
Anal major, anal ultimatum.
That's
Prepare for the hemorrhoids.
Fuck.
I don't know how you go off on those tangents, but
I don't know either.
Speaking of that, let's talk about the lips. Let's talk about the other side of the body.
Of the digestive system.
Up here.
Okay, lips were at an all-time high with lip filler. It was all the rage, and then all of a sudden, because Kylie Jenner made this lip kit and she made her lips bigger, and it was a surgery, and was it not? And all of a sudden, with social media, everyone had big lips, and then everyone looked the same. And then they all look like swollen labias. They just were huge, big lips. There was no art to the lip. It was insane, the craze that had happened. So, and everyone was getting it younger and younger in their 20s. But then we started to see what really happens after lip filler and too much of it. So that starts to migrate and it starts to move up. And that was what do you call it? What's the term that we not monkey lip?
It's the Marge Simpson.
The Marge.
Yeah.
Because I feel like it would protrude out, and you could always see it on the side profile. Also, the bottom lip was huge. It just didn't have any kind of shape to it. It was just hanging, which looked gross on a lot of women.
And it was too heavy, so you couldn't get the actual lip to even out, which is what a natural lip looks like, because it was bigger above the lip, which is the perioral area, is bigger than the lip itself.
Okay.
So it's way out of proportion, way too heavy.
Yes.
But I do think the industry is changing. Like you said, there was a big craze in was that 2015, 2016. And then I feel now it's all about tasteful lips. It has always been. I feel like that's always been my style. But now it's all about okay, you don't want crusty, dusty lips. We're not... it's not in to have thin, lined up, lipsticks bleeding out of your lip line.
Where are you doing that?
That's what mine look like right now.
No, they do not.
But yeah, so that's not it. But having a little bit of lip filler, getting rid of the old, chunky, nasty, heavy lip filler, and then having just a little bit for hydration.
They look like they're going to pop.
There's definitely girls that can rock a full lip. Me and Angel sitting here with huge lips.
It fits your face though.
Yeah, she's Mexican. I'm Filipino. Ethnic girlies can tend to rock it a little bit better, but it still doesn't look heavy. And all of it's contained within the lip line, So, but if you don't have that anatomy, then it's time to get rid of the old filler.
Do you still see injectors and people on social media posting bad lip filler?
Totally. Just because with any style, think fashion or anything, people get stuck in the past. And so
Technique. Their
Yeah,
technique
their
doesn't
technique
change.
is bad too.
They don't
Their
get
product.
extra, learning. They don't learn other techniques. They kind of stay in their old school way of thinking. It's like kind of if we still offered microdermabrasion, right? Like other things happen, evolve, other trainings. You gotta learn, you gotta expand, you gotta learn from other injectors and their techniques and kind of apply. And also every lip is so different. Like she was saying, Lexi eats fillers. Her body just like gets rid of it within months.
Where is it? We don't
So
know.
that's a good thing to address. Like, why does lip filler last in some people longer than others? And that's like, I don't know if it's like genetics for you or maybe like because you did Accutane. But we all make in our body something called hyaluronidase. And you guys know this doing skin. So it's how fast does your body break down hyaluronic acid. So we naturally have hyaluronic acid in our skin, and there's like products. I know I've heard you guys talk about it as estheticians, like products that help slow down that hyaluronidase in our skin. Well, some people just break down hyaluronic acid faster than others, and it tends to be like dry skin people, or I don't know if it's the Accutane or whatever. You make a little bit more hyaluronidase than like say someone with like I don't know, just like they break it down maybe within a year, which is normal. And yours is like literally, I kid you not, Lexi's lips go away in like 2 to 3 months.
Yeah. I've seen
3
it.
months on a good injection.
Yeah, and there's no migration. It's just gone. Yeah, so
Maybe God wants you to have skinny lips.
I don't want what God wants.
your body just makes a lot of hyaluronidase.
I think so, but I do think Accutane does play a little bit of a role, and there's no way to increase or there's no way to decrease the amount of hyaluronidase your body produces.
No.
It's a bummer.
Okay, so I was one of those that kind of ignored and didn't know like if my filler was migrating, and Sam came to me and she's like, I just don't want to give you more lip filler. It just feels like it's moving up from all your old filler. And I was like, well, it's hard to see it, right? Like when you live with yourself and no one's going to tell you. So we took a side profile and you could literally see my upper lip just kind of coming out. So I didn't necessarily have big, huge lips. It was all moving up towards my nose. So I had to do 3 sessions of Hylenex. And Hylenex is just an enzyme that breaks down the hyaluronic acid in the product. That one was painful. That part was painful, like the first injection. And then it blows up. I have a photo.
I have to show the photo.
Because I didn't know. I was all, yeah, let's do it. It was like on a Tuesday. That's her massaging my lips. I don't know if you could zoom in, Brennan, for that. Yeah, he can.
And I feel like it's a red flag if your injector keeps injecting over lip filler that's migrated, right? That's a huge
Look at me with blood all over my face. I mean,
That's funny.
it's not a cute photo. And you stay puffy and swollen like that for probably about 4 hours, with each half hour getting better. And then at the night, you just feel, we call her Deborah.
Yeah,
No offense if your name is Deborah. I just called her Deborah with my skinny lips. So because it took 3 sessions, with the first time you did it was February of 23. We waited how long in between to do the second Hylenex session?
2 weeks is fine.
2 weeks?
Because you look crazy swollen that day for like a couple hours.
Yeah.
It's kind of gone by the night. By the morning, maybe a little puffy from the trauma of the needle and stuff. By 2 days, the filler that's going to be gone is gone. So people think they look crazy for weeks on end, but you actually heal way faster from dissolving than you do from lip filler. And then 2 weeks just to help your body heal from the trauma of it, and then you do it again if you need. If you had like 10 years of filler.
Right. I had from like 2008.
Yeah. And it was all types of products from who knows where.
Radius, Restylane. I don't know.
You did not have Radius, but you definitely had like Versa, Juvederm.
Juvederm, the old school Juvederm.
Old school.
People still use Juvederm over lips?
Definitely. Probably more than Restylane.
Okay, so I had 3 sessions, but you're saying it's situational. So someone who's in their 20s only doesn't have their lip filler, you can dissolve it, may not take 3 sessions.
Right. It might take 1 vial. You were like 3 sessions, like I think 8 or 9 vials. It might take 1 vial for some people if they have like just a little bit of migration in one area, or they maybe only had like 1 syringe of filler and they, that happened to migrate. It's okay. You don't need to be so dramatic. We were just like we were doing like the factory reset on your lips.
What about those women who are like, oh my gosh, I don't want lip filler. My husband doesn't agree with it because I don't want to look just not natural. I know you hear this many times in a day, but what is your response to that?
Well, like what I say or what happens in my brain?
What do you say?
What do you say?
Well, what I say is filler,
Get a new husband?
Well,
That's what we think.
one thing is I do always get somewhat offended when they're like, I don't want to look like a duck. And I'm like, bitch, did you look at my Instagram?
Yeah.
Do you think that I do duck work?
Yeah.
Like,
That's what you want to
That's
say.
what I want to say.
It's like when people are like, are you sure you're like,
Love yourself naturally.
No. No, thank you.
I don't want to.
No. Yeah, then don't get the hair transplant.
Yeah.
Okay. But I think what I say is that like there's different ways to do filler. There's different types of filler. There's really soft filler that I can use that is more hydrating. You know, it's just going to take the wrinkles out. It's going to help so your lipstick doesn't bleed outside of your lips. It helps prevent like smoker's lines. Mm-hmm. There's like a way, and it'll never look different than your own lips, but there's always downtime. So if they're trying to hide it from their husband and the husband's not out of town or whatever, I'm like, you're gonna go home fresh off the needle and be pretty swollen.
Mm-hmm. Yeah,
that's
especially
okay.
the first night.
Yeah,
in the morning.
It's just part of it, you know. And I always say they're swelling up to 6 weeks, but most women can hide it from their husband after like 2 days.
Well, we have two types of clients: the ones that want to hide it from their significant others, and the ones that come in with their significant others, and they
and they're all hyping them up, holding their hand. Yeah, because it always heals. So when I post on Instagram my before and afters, I would say most of them, unless I say these are healed lips, they're all fresh off the needle. So swollen, I just cleaned the blood off, you know, fresh. They heal to be about 20 to 30% of that after. So I think that's like a good thing for girls to look at on both sides. Like the ones that want really natural lips, like, okay, good. It doesn't heal to be that. But then someone that wants like, oh, I like these plump, juicy lips, just know that it's going to take like building to get there. So just always think the after is fresh off the needle, super, super swollen.
Mm-hmm. Mm-hmm. Okay, someone's coming in. They're like, I want lip filler, and they have virgin lips. What product do you tend to go to to have them look more natural? Because a lot of people will say, I don't want it too big. You know, you hear that all the time. So what product are you reaching for as opposed to what you used to grab for? I feel like it's an art for you.
Yeah. So obviously, I mean, anybody that knows me knows I like the Restylane portfolio. I use stuff on label, off label, all the things. Say it's someone who just wants hydration. I actually grab for Restylane Refine, which is off label for the lips because it's so soft. It's more just like for like plumping up fine lines, bringing hydration. It's really super flexible. It's really beautiful in the lips. The on-label thing is Kiss, and I think when I was new, I only reached for Kiss because it's the only thing on label. So I'm like, oh, well, this is like safe. But now, you know, I reach for literally everything except lift.
What did you put in mine?
Contour.
Yeah.
Define. Yeah.
Which is a little thicker of consistency.
Yeah.
Correct?
Define is probably like the most robust. Contour is a little bit thicker. You know, there's things that are less hydrophilic that have more structure.
So with all these different types of filler, are there certain ones that migrate less often than others, or is it all just depend on your anatomy?
Filler can all filler can migrate depending on, you know, someone's anatomy for sure, but there's definitely more that I think Juvederm migrates a ton. I think Versa migrates a ton. That's going to be controversial. Like, that's just my preference. Just like we were saying, it's an art form. People have their preference on paints and blah, blah, blah. But, like, that's my preference. And that's what I see.
Is there anything you could do to avoid migration aside from having a good injector?
And not overfilling.
Okay.
Sometimes people that are really like hypermobile around their mouth, toxing around their mouth to help them not like
contract as much.
Yeah. Mm-hmm.
Okay. That's cool.
Yeah. I think like you.
Maybe that's why mine dissolves so fast.
No,
Shut the fuck up.
because yours doesn't migrate. It
doesn't
just
migrate.
No,
No,
it just
just goes
goes away.
Yeah,
Yeah.
yours just disappears.
Yeah.
And it doesn't matter like what we use on you.
That's what I was gonna say. Maybe product change or
no,
something.
yeah, I've used everything on
Cement?
Lexi.
Cement.
Yeah.
She just
Some people just need more maintenance than others.
And what about lip implants? I've seen
I don't
there was
know
the Real
anything.
Housewife, Taylor. She was on Orange County. And
Okay.
she had a lip implant, I think top and bottom. Do
That's
you
what they
see
say
that happening anymore?
that Kylie did.
Someone's should I do a lip implant?
I have no idea.
I
Consult with your
scary.
I
surgeon.
feel like no.
Scary.
Yeah.
That
I
lip
mean,
lifts.
how are they going to age? Like, what do they put? What is implanted? Fat?
Yeah. I have
Collagen?
idea.
No, I think it's an actual
Like a prosthetic.
because when they do chin implants, it's like almost like a boob. So it's like, and they put it right in there.
No, chin implants are like hard though.
Huh.
Yeah, but it's like a
It's like a silicone bag.
yeah, like it's like a. So imagine if you wake up and your lips up here, at the side of your cheek.
No. What happened?
I mean, like bullhorn lip lifts are definitely needed on some people.
What is it called?
A bullhorn lip lift where they cut along the
Nose.
nose. Yeah. And then they like lift the lip up so it's closer to the nose. So the philtral column is shorter.
Okay.
Some people definitely need that. I think that's good.
Okay.
That's
But then you have a scar underneath.
You do, but as we age, so whenever I do lip filler, that's why I always try to lift up the lip closer to the nose. I see that in Angel's lips, like, because as we age, everything drops, like our boobs, our butts, and our lips drop
going
too.
down, honey.
Everything is going down. Yeah,
south, okay?
everything drops to the ground, including
drop it
our
low, drop
upper
it
lip.
Wait, okay, this is a total side tangent, but did you guys watch The Substance?
No,
I've been on Yellowstone for too long.
I don't watch
tell
TV.
The Substance, what's her name? Demi Moore. She looks amazing, but there's something about her lips in that movie.
I have to look it up.
We'll have to look it up, but if you've seen The Substance, you probably know what I'm talking about. But everything's kind of sagging. I'm like,
Do you recommend
She
that I
looks
watch it?
great.
It's a really good movie.
we haven't finished it yet. We got
Okay.
halfway through, but it's spooky. It's weird, but something's up with her lip, and I would like you to investigate.
Okay, I'll watch it.
Yeah.
They've also, she was morphed looking for a while
Oh,
there,
she
and
got
they took out
spooky.
a lot of her filler. So who knows what? Yeah, because that was a trend. Remember
Oh, my
buccal
Lanta.
fat,
So bad.
and everyone was doing it. It was a day surgery, and I was like, one of my friends did it, and then all of a sudden she started to get wrinkling hair. Only about 2 years later, wrinkling. Every time she would smile or laugh, it was starting to wrinkle right where that fat pad was. And I think we're seeing people like,
yeah, I'm literally putting Sculptra in people because as we age, we lose like fat in the preauricular area and the buccal fat area. So I'm putting Sculptra because it's preventing the look of like aged faces. So
People are paying for that surgery.
that was a quick trend though. I think it's done. Now everyone's just on like GLP-1s and just looking gaunt anyways. So they need Sculptra.
So how do you feel? That was our last podcast. How do you feel, or can you tell me when someone walks in and they have too much filler and you don't want to hurt their feelings, or how do you go about saying to them, I don't think that you need more filler. This is the path we should go. Like, how do you do that without offending them? Because maybe they love their lips and they're wanting more. So how do you deal with a situation like that?
Well, I say it just like that. So I'm kind of blunt in general, like in life. And then when I sit down with the patient, I'm like, I think that you have too much filler. And I think that it's migrated, and I'll give them the mirror, show them. I'm like, so do you see when you animate, it kind of puffs up right here? And a lot of people actually say, oh my God, I didn't realize that.
Okay.
And like, that's like 90% of my patients. I'm like, so see that? That's like filler. That's not your body. Like, we should like restore your natural anatomy. And most people are fine with that. I'm just very straightforward like that. If they're like, I've had people that are like, I'm from LA. I love this look. I don't want to change anything. Then I actually say like, well, I won't fill you anymore. So if you want to go to if I can't post your before and after, like based off like how it looks, if I think it's ugly, then I'm not going to do it. Because
That's a good
that
injector.
person is walking around on the street being like, Sam's my injector, looking spooky. So I just have to be like, maybe it's not the best fit for us. you know.
Okay, if someone is scared of pain from lip filler, what does it feel like? We can both attest. But what are...
Well, she knows I sing to her and grab onto her.
Yeah. I mean, like Angel and I will do our lips without numbing. You do it with topical. And so the spectrum is large. I had a patient tell me she thought it was worse than childbirth.
No. If that's true, I'll give a baby no epidural. Like,
Yeah, like,
not bad.
and me and Angel won't even use numbing. So obviously the spectrum is large. I think it's like a 3 out of 10, you know? So, and it's quick. There's numbing in the filler, but everyone's
Now,
different.
Hylenex does hurt because the enzyme burns a bit. You can feel it burning. You could almost feel it eating those little baby
It turns it into
or
water.
the enzyme eating, the hyaluronic. But the actual filler, like she said, I mean, the poke hurts. Like needles just hurt. And we have the most nerve endings in our mouth and our nose. So you're going to feel a greater sensation when she's poking you. But it also has numbing in the product. So once the product goes in, or most of it should, I don't know.
It does.
Okay. Once it's going in, it starts to numb. So you really don't feel like the second or third pokes. It's really the initial one for me.
Also, I am a little different as an injector because you'll see Instagram, kind of like clickbait. People will be like poking all the way down the vermilion border like multiple times. Have you ever seen that? Where they're like, it's like 8 serial pokes all the way down the border of the lip. And it's just really traumatic for the lip tissue. I try to like treat the lip tissue like a delicate piece of silk. It's really, really like soft and delicate, and the infrastructure is like very mobile. And so I like tend to poke in one spot, 2 spots maybe. I'll use the same hole. I'm like very gentle, and I'm not like massaging like, like I treat it like it's really delicate. And that helps it helps like preserve the lip. It helps with pain, but it's also like I don't want my patients migrating, so I'm not going to destroy their vermilion border by poking it a bunch of times. I mean, you've probably had your lips done where you get poked 700 times. I think like as I've evolved as an injector, I treat it differently now too.
I also
So it hurts
think
less.
your background, a lot of people don't know that you worked at Children's for a very, very long time, at least 8 years or something like that. And I think there's something I was singing your praises the other day to another PA, and I was meeting with her. And I just said, you have a gentle approach because you were working with babies for so long. Yes. And you're also not afraid, right? So like when you're dealing with someone's baby and you have to be that gentle, but also be very accurate in anything that you're doing at Children's. When you carry over, obviously it's an art and all that goes into play because I do feel like you have an art for it. Your approach and the way that you're calming, because you see us joke and we laugh and we tease, and when I'm sitting in her chair,
it's professional.
She turns on her nursing degree to the 10th level, and she's like, okay, it's okay. Are you feeling okay?
Yeah, Angel's hard to inject. She moves.
No, me that doesn't get any love often. I'm all, no, I'm okay.
No, you're like, stop.
She's like, she's wiggling. She's like scooting down. I'm like, okay, you're done in 3, 2, 1, all done. She's like,
and I'm like giving her vaccine with it. Yeah, no, distracted.
No, but no, it makes me feel better because the approach is different. And I've been injected by many nurses and even a couple doctors, and they're just like,
it all hurts.
Savage.
Yeah, it all hurts.
I'm like, oof.
And no offense to some plastic surgeons, but I think that when you're not doing it all the time, they're heavy-handed. And so when they come in with the needle, it's just like, ugh.
Yeah.
No.
Rough. Yeah.
And rough.
And the lips are like meant for like kissing and communicating and eating, and like treat them like they're like special, you know, like don't treat them like it's delicate piece of silk. Like, but yeah, working with kids, if you think you don't want to get injected, imagine like a little baby. Like, you know, so it's like, okay, well, we got to do it, but also like try to make it as quick and easy as possible.
We're all just little babies in the injector chair.
I also offer mucosal blocks or dental blocks for people that really don't want it. I can say those blocks suck though, because one, it's pokey, like to try to get the block, and then you're like numb, like you went to the dentist for like 2 hours, which sucks.
Not worth it.
It's not worth it, but there are some people that to them, it's worth it. The thinking lips are worse than childbirth people, it's worth it.
For sure.
Yeah.
Okay, have people ever had an adverse reaction to filler? Is it possible to be allergic to lip filler?
It's rare because really the only thing in it is hyaluronic acid and lidocaine. Okay. It is rare, but yeah. I did have one patient I filled one time and she just swelled. So swelling's normal, but she swelled really crazy. Like I was like, oh, that doesn't seem... She healed fine. Her lips ended up super like natural. She loved the result. But I didn't inject her again because I thought, oh, that seems like not a normal reaction. So adverse, yeah, was it abnormal, but nothing bad happened.
People get swollen. I just think also the lidocaine, your sensitivities to lidocaine, that all plays a role in what's, because I mean, it is hyaluronic acid. Your body naturally produces it, can't reject it. So I have to like almost say it might be the lidocaine sensitivity. Because a lot of allergic reactions we've had in the past is because we had a different lidocaine, our topical for numbing, and people were just more allergic, and so we had to change that. And it wasn't the peel. Everybody always thought it was the peel. It wasn't the peel. It was the numbing.
Yep.
So just, I guess, knowing that. I think a question that a lot of people have, can you get this if you're pregnant or nursing?
Nope.
Okay. And how long do you have to wait after you're nursing? Next day?
Nope. As soon as you cut the baby off from the titty, you're good.
Okay.
Yeah.
Yep. And there's no like, it's not like Accutane where we know it's teratogenic. We know all these things. Like say you're trying to have a baby. I've been getting this question actually every single week so far. 2025 is a big baby making season, I guess.
Oh my God, I got a someone asked if you could do BBL if they're pregnant.
Yeah.
No.
Pregnant clients currently.
Yeah.
Interesting.
So the thing is, it's not teratogenic. It's not a known issue.
Wait,
so I always
teratogenic mean?
like harmful to the fetus. Okay. Yeah. So it's not like a known thing where like Accutane, you got to be on 2 forms of birth control. Keep getting your injections until you're confirmed pregnant. It's more just if something happens to your baby, I don't want to be liable. If like you have and then you're breastfeeding, okay, fine. Does it pass through the breast milk? Probably not. Hyaluronic acid, whatever, but if something happens to your baby, I'm not liable.
For sure.
Yeah. So, and they don't test on pregnant and nursing women. So
it's not their top study.
No.
Go ahead.
And I was going to say, there is a study one of my clients sent me. They did test a subject group of, I think it was like 30 women, breastfeeding to see if Botox entered the breast milk, and it didn't. There was no trace of neurotoxin.
Yeah.
I won't touch you with a 10-foot pole, but just for liability purposes, I don't want your poor, if anything happens.
Wait.
Your kid has ADHD. We don't want...
Yeah, it's not my fault. I'm sorry.
We might.
Got filler.
My mom was probably getting high. Okay, well, the next thing is I wanted to say, if they get filler that day, can they make out with somebody that night?
Yeah, what's the post-care?
What's the post-care? Well, yeah, for sure. I mean, it's going to hurt a little bit. You'll be sore that night. You're sore for like a couple weeks, but yeah, it's not going to like make it migrate if that's the cue. One thing is that the poke holes are open for 24 hours. So if your partner has like, you're given a BJ, they haven't showered, or like
the salt, the bacteria.
Yeah, like, or like their mouth bacteria entering the poke
Why are you
holes.
ewing? Like, it's so gross.
No, I'm saying like sucking a dirty dick while you press lip filler. That's gross.
First of all, why would you be sucking a dirty dick? That's so gross.
Okay, yeah, take a shower before the BJs, please.
Please, for the love of God.
It's not gonna,
showering.
but it could cause more inflammation. You're sore. If you're doing anything that is like, you're sore and you're forcing it, you could wake up with really swollen, beat up lips. Like, bad. And sometimes we've had to call in like steroids and things for people that have like not followed post care because they're doing crazy things. It's injured tissue. So imagine you sprain your ankle and then you're like punching it. Like it's gonna be more sore, it's gonna be swollen, it's an injury to the lip. So give it like a couple days at least.
Okay.
But it's not gonna migrate.
If someone's getting married, say on a Saturday, say the 14th, Valentine's Day, how much in advance should they get their lip filler so they don't have in case they have a reaction or swelling, or just to play it safe?
So I say 6 weeks because And that might be playing it too safe, but for me, it's not, especially for weddings. I'm like, I don't fuck with brides and weddings. Like,
You want them to look their best.
They need to look their best. And 6 weeks is when all the swelling's gone. So MRI studies show there's even a small amount of swelling up to 6 weeks. So yeah, I want their lips to look, I don't want them to look stiff. I don't want them to look lumpy. And if there's any amount of swelling, that's what causes the stiff, lumpy look is swelling. So 6 weeks.
Okay.
That's something I noticed too. Whenever I get filler, they're lumpy and bumpy for a while.
Yeah.
How long does that typically last? Is it up to the 6 weeks or?
So normal up to 6 weeks. Okay. So that's caused by, so think hyaluronic acid gel. What does hyaluronic acid do? It pulls 1,000 times its weight in water. So you have injury to the lip from the needle. So you have swelling up to 6 weeks. So if there's any swelling from injury, that hyaluronic acid is going to pull that the tiniest trace amount of swelling towards itself and cause a little lump. That's not how it heals.
No.
Once all the swelling's gone, the hyaluronic acid is nice and soft. So it's normal up to 6 weeks, actually. I notice it even in my own lips. Up to like the 6 week mark, I'll still be a little tight, a little
You can't
lumpy.
see it. It's more
You can't.
you just touch it.
Yep. Touch it with your fingertips, but you can't see it.
Yeah.
Like, I can't see it.
I don't have any lumps.
Oh no, you're so great.
Oh, really?
I literally, when I'm looking at both of you, I'm just staring at both of your lips.
I overlined and then I do a rounding instead of a point arch.
But you can see, like from the side, the projection, it's lifted up. It's not the puffy Homer Simpson look.
Well, and
Marge
getting rid of this part is the key for that.
Oh yeah.
So it's like
that's where
her
she
lip is
dissolved.
now.
It was all up here. Remember how big it was?
Oh yeah, of course. I couldn't unsee it.
Even if you tried.
No, wait, what is that? I always like, no one at the office likes to talk at me because I stare at everyone's faces and like analyze.
Oh yeah, we can't help it.
She'll be like, "Oh, your lips look good. What were you saying?" Oh.
Emma, I think we need to add a little bit more to the right side.
It's fun.
Yeah.
Okay, what was your question? Sorry.
Oh, it was just a side note. What's your favorite lip combo? Like, what lip glosses are we loving that are hydrating, don't dry the lips?
Okay, so I think what I'm really into this winter is a lip stain with like a really moisturizing, the Ole Henriksen peptide stuff, whatever, I forgot what it's called, but that has been like the most moisturizing thing that I found. My friend Elena, she's my friend and patient. She's like, you need to try this. It's better than Summer Fridays.
I need it now.
Yeah, and so I got that. It is the best. So I literally in the morning will stain my lips with Sacha. Is that the
It's on
viral?
Amazon. We all have. I have every
the viral
color.
Amazon, TikTok,
They're
whatever.
$12. They last
So
about,
good.
I don't know, maybe a few months, but it's awesome if you're busy during the day and you don't have time to reapply. It makes your lips have just some color. It's really great.
So honestly, staining my lips or lining over, I actually still overline because I love a big lip. So like overline with the stain. And then throughout the day, all I'm applying is a hydrating cream, especially in winter in Colorado.
Yeah,
It's too much to be like reapplying lipstick.
Yeah, no, and it smears
and the lip liner goes away. You know, I like a lip liner, but it goes away. So
yeah,
stain.
I found a good lip gloss at Walgreens.
Show it, because I hate. Well, okay, I like this one, but this is like you don't want to put it on every day.
Yeah.
Okay, the Ole Henriksen, I've heard really good things.
Yeah, I have. What's in my cart?
It's called. It's by Maybelline actually, and it was
Maybelline's having a moment.
$8.99, and it is a great color. I actually saw this color at Charlotte Tilbury, and it's pretty similar. And I paid $8, and it's actually just as good in my opinion.
Oh, and it has hyaluronic acid in it.
I like it.
Most lip products I feel dry my lips
nice.
out, which
It's the color I'm wearing right now, but I feel like it's just soft.
it's not matte.
Yeah. What color is this? Petal.
Petal.
Yeah. Maybelline.
Okay, lifter lip gloss for Maybelline. Sorry.
Because we always have, like,
know.
you have a few here as well. This
Sucks. That one sucks.
Yeah, that one's not that great.
Yeah.
Yeah, and
Summer Fridays is overhyped. Sorry.
It's okay. I mean, I think it was a trending one.
Yeah. Also, glossy lips are in. Guys, quit with the matte, please. They look
Especially in
crusty beyond.
We can't do
Yeah.
No, a matte is nice, like the beginning, and then
Oh no.
2 hours into
so
your
bad.
happy hour, you're cracking. It
If
looks
you're
bad.
over 21, don't with the matte because it looks old. Like I look at some of those matte lips and I'm like, you look 30 years older
so much
than you are.
drier than it needs to look.
Yeah.
Okay.
There's no filler in the world that can fix that.
No, there isn't. Get that makeup removed out. But we're doing a lip special.
Okay. For our listeners only, you get $100 off of lip filler. Say that you heard it here on the podcast.
You have to call our office.
You have to call our office, schedule. You get $100 off. And or if you were in my situation, you had too much filler and you need to be part of filler rehab is what we call it.
Yep.
You get $100 off of that.
Which is so exciting. So you can get some romantic lips for February for Valentine's Day.
I love February. You guys don't. I just love love, and I love couples, seeing them at dinner. I just love it. It's
I was gonna say, I used to hate Valentine's Day, but now that I'm like dating, I'm like, buy me flowers, buy me gifts, take me out, like spoil me. I want to feel like a freaking girl.
Yes, like pink, red, hearts.
Yes.
We love it. Okay, last question. Can you inject over other people's work? So I know it's like with microblading. No one will take a microblading client if they've had it previously done somewhere else. What do you say to that?
I will, depending on the work. Yeah, so but like if you come in, you're like, oh, I've had lips done and it looks fine, I'll totally inject. It's just hyaluronic acid.
Yeah.
You know, and sometimes it's better because they've like have a little foundation I can build on.
Okay. Does it matter what they previously were injected with, or it all kind of goes together depending?
As long as it's not lumpy, as long as it's not lumpy and or migrated. If it's asymmetrical, fine, I can fix that. If the lumps I can't really fix. Yeah.
Yeah, we tried Coco. She won't mind us saying this. She had lip filler from God knows where, and it was
Okay, HIPAA.
I know.
No, she'll be fine with this. She has come to us to try to take out the filler. Many times.
I was milking plastic. I don't know what.
Squeezing it and shit was coming out of the lip.
Yeah.
It was solid.
It was weird. It was a bizarre,
like,
whatever. I don't even know what was
silicone?
in her.
I don't know.
Alibaba.
It wasn't being dissolved by
She thinks
hyaluronic
it was
acid
from
or
Alibaba.
hyaluronidase.
Yeah, plastic. That is crazy.
It was not hyaluronic acid. That's
So,
for sure.
I mean, it can happen, especially if you're like, oh, my friend's a new injector. She wants to inject me. I mean, just be careful. It's your lips. It's your face. But thank you so much, Sam, for being part of the podcast. You're so
Thanks for having
awesome.
me.
We always learn so much. I mean, we always want our lips done. I sat in her chair and I said, I want filler, doesn't matter where.
What did you do?
lips.
My lips. Okay. Or I'll sit and I'll say, I want Botox, doesn't matter where.
I can't.
You're like half a unit.
For my lips?
No, just a Botox.
Oh.
Well, and sometimes I'll stare at you and be like, it's time. I gotta keep her face up.
She's a face Maria.
I was like, maybe I should go even bigger. And she goes, well, you're on TV. And and she's trying to tell me no. And she's like, and you don't want people to be like that. You're that girl. And I'm like, okay, Sam, just say no. But anyway, so happy Love Month to everyone. Thank you for listening. Don't forget to follow us on our podcast. It hurts to be, follow us on our Instagram. It hurts to be pretty podcast.
Leave a review, book your lip filler, call our office, and book with Sam or me.
All right. We love you. I love you. I would shower
The
you.
millennial heart.
Oh, wait.
Or no, not the millennial. This is the millennial heart. The Gen Z heart.
Oh, wait.
Gabby, do you know how?
Wait. Oh.
It's this one, right? It's so
Oh,
hard.
doing
It's
it.
really hard.
I feel like I'm throwing up a crip sign.
I know, Angel. What is that? You got
West Side.
Love you. Also cute one we saw. Maybe was it Squid Game where they do this? Do you see? It makes a cute little heart. Hey, look at how cute.
Wait.
This way. Look at it's a cute little baby heart. Isn't it so cute?
Wait, I don't see it because my fingers are really fat.
Look at it. Heart. Okay, guys.
Okay, I love you. My nails.
Love you. See you next week. Bye.